My name is Gonzalo Moreno. I am a senior analyst at the World Policy Analysis Center. Just to tell you a bit about what we do, because it'll inform the rest of the talk. We really work with national policies on a comparative basis. We want to find out which policies have the most effect on health and well-being outcomes, in this case, child health and well-being. And we also want to make as much information about policies and their effects as possible available to policymakers, to other researchers such as yourselves, and to civil society partners. So today we are going to talk mainly about work we've been doing over the last 3 years that link the rich policy data that we produce with outcomes in low and middle income countries. So just to set the table a bit, doing this sort of work in low and LMICs runs into data barriers. So unfortunately, you can't always do randomized controlled trials on all the possible interventions that you might implement in a country. Just thinking back to the talks yesterday about the history of universal childcare in Quebec, sometimes there's a project that comes around, it's applied nationally or at a provincial scale, it has a lot of social consensus behind it, has a lot of political will behind it. We're talking policies like implementing tuition-free education or prohibiting child marriage. So if you can't randomize that at a national scale, you go to the next best thing, which is a natural experiment where you compare countries that do the policy change with countries that don't. Very few people do this work in LMICs. We check periodically, and every time there's not that much more research than the time we had previously checked. There are a lot of people that work in this area that do maybe comparisons of US states or comparisons of high-income countries, but LMICs, not so much. And the data gaps that become apparent when you try to do this work are basically two. One, you need policy data about the intervention that is rigorous and it's comparable across countries, and also that is longitudinal. And it will become apparent why this is important in a few minutes, but basically you need to know exactly what year the policy changed. And that's not as straightforward as it might seem. And the other side of the equation, you need outcomes data that allows for analysis around policy implementation. So you don't need fancy, panel data following 100,000 people over 20 years, but you need a before and an after point. So the short version of how we deal with the policy data issue is we create it. We've been doing this for the last 20 plus years, and we like to think we're pretty good at it. The way we do it, I'll give you the very short version, and I'm happy to expand on it during the Q&A. We break down a particular policy into components that we know are both important from the point of view of policy design, and that are comparable across countries. We try to focus not only on rights, but also on measures of implementation and enforcement. And because we want to show our work, we include the text from the law, the particular policy that we're analyzing, so that people understand where our interpretation is coming from. All of this is put into a coding framework, mostly in Microsoft Access. And everything that we do, it's coded by country. So like the main unit is usually the country. Sometimes we do subnational analysis in provinces or states. And every sort of entry in the database is double coded. So we minimize, clerical errors and, differences of interpretation and so on. So that takes care of the lack of policy data issue. And then come outcomes data. So like a lot of people that work in this space, we take data mostly from the demographic and health surveys and the multiple indicator cluster surveys, so DHS and MICS. A lot of the data that, for example, Dave Gordon presented yesterday morning comes from those sources. The sort of problem comes in when you realize that not any DHS or MICS will do. So because you're trying to see the effect of a policy, the effect is sometimes lagged. When you're talking about education, it takes years or decades to see that in the outcomes that we're looking at. We need the surveys that we have to be quite spaced. So at least 5 years between the first and the last survey. This is a map of DHS availability. If you're dark green, IPUMS, the data consortium at the University of Minnesota, has harmonized it, so you're good to go. If you're not dark green, you still can do work on it because you have the lag and the gap between surveys, but you're gonna have to do extra legwork. Whatever IPUMS do, we do on our side if we're missing surveys to work with. So over the last 3 years, with support from the Hilton Foundation, we've created this project where we're linking our policy data, as I said, with outcomes data from DHS and MICS and other surveys, which I'll get to a bit later in the presentation. But we end up with over 1,500 policy years of data. So we have data going back in some cases to the 1990s and even further than that. And there are policies that we know matter to early child development. And we use those policy data to identify natural experiment. And then on the outcome side, we take DHS and lately some mixed surveys from 32 African countries. We're up to 1.5 million children and 1 million women. If IPUMS has it, great. If not, we basically use the IPUMS codebook to get the data that we're missing. That's especially true for later surveys where DHS has produced a survey, but IPUMS hasn't gone around to harmonizing it. And if we wait for IPUMS, we'll run out of grant before they get to it. With these two components, we basically do a difference in difference designs for a number of different studies, which Jody will talk about. We compare changing countries that introduced the policy versus changing countries that did not introduce the policy. And the idea here is that because we're working in many years, sometimes decades, there's always going to be an underlying change, and we want to see the difference between those two changes. As usual, we control for differences at individual, household, and country level. Some of it comes from DHS, some of it comes from sort of national level data on healthcare expenditures and so on. And we also control for effects over time. And I think the ultimate goal here is to get to causal inferences about whether the policies that we're studying have an impact on ECD. So I'm gonna pass it over to Jody, who will tell you about the good stuff, the specific studies we've been doing. Same presentation.
Thank you, Gonzalo.
Yeah.
And so great to see everybody, even virtually. I very much wish I was there in person. So just building on what Gonzalo had to say, the whole goal here was to try to figure out which policies work at a national level and to situate this in the middle of what we've heard so far, or both that I had the joy of hearing and what I understand has been presented over the past day and a half. We have the really important, compelling big picture pieces that kicked us off from Kate and David, kind of large scale change we need. But a lot of the questions and answers were, okay, what do we do? How do we get there? We've also heard very compelling findings of what location-specific initiatives have yielded when they've been effective. This kind of a middle level. What works at the national level, but like those compelling specific intervention studies really designed to rigorously evaluate what works and what doesn't. These studies that we've done as part of this initiative really focus on, are there policy levers that would move both gender equality, so addressing one core aspect of inequality, often move social class inequality, and impact early childhood. And I'm going to walk you through about 4 each of them. I'll first give very briefly the model, and we'll share all these slides. So globally, 122 million girls out of school. Half of those out of school children are in Africa. Intergenerationally, we do see this lack of education as likely impacting a whole series of social determinants of health that mattered to their children in early childhood. That was the motivation for this study. Next slide, please. So what we did was we tried to study when girls themselves come of age, when secondary education is tuition free. Therefore, they have a lower barrier to attending secondary school. Are there benefits when they're women to their children? Are there benefits to the next generation? You can see here we had 3 study countries, Liberia, Rwanda, and Zambia. And then we had the 6 countries, see Benin through Zimbabwe, that during our study period did not have free secondary. So maybe they passed it later, but didn't during this. And then we look at the wasting of their children. Next slide, please. What we found was very significant intergenerational effect, that when tuition-free secondary education was introduced, it led to an 18% reduction in wasting of the children. So you can see specifically when we have enough data to do country-specific estimates, this was particularly high in Rwanda and Zambia. And the tuition-free primary alone was not enough. So before I go on to the next area, I just want to pause and say, why might it not be obvious that this would be beneficial? And there are a lot of reasons. You know, there have been concerns raised about when tuition-free secondary occurs, are there not enough teachers? Are there so many other obstacles to going to secondary and for girls staying in that it won't have an impact? Does the class size get too big? This doesn't mean all those challenges aren't real, that they don't need to be addressed. However, it does say, even in the context of those challenges, making it tuition-free mattered. Next slide, please. We also looked at other kinds, we looked not only at the health outcomes, but how did it shape access to health care? This is a study with those same countries, looking at, as one mechanism of the change, did it affect who got antenatal care? Next slide, please. And indeed, the likelihood of getting at least 4 antenatal care visits went up in all the treatment countries. Now, I just want to mention, we think the mechanisms are much more than that. And that's one of the key things about addressing social determinants of health. It's going to have affected ability to work, income, as well as to access care, ability to care for children after they're born. But this is just looking at one of the pathways within it. Next slide, please. Another key policy, again, that matters to gender equality, that we think likely matters to the next generation, is child marriage. Why could having a minimum age of marriage law impact the next generation? It's because of the high maternal mortality and infant mortality that occurs with early births, but it's also because girls who marry young are more likely to be subject to violence, more likely not to finish school, have low income, etc. Next slide, please. What we were able to do here was look at countries. One of the real questions we've had is, is a child marriage law alone enough, or do you need to give girls an alternative for the child marriage laws even to work, including going through school? We were able to separate out countries that had both tuition-free secondary and child marriage laws from those who only had one policy or the other in place, and those who had neither policy. Next slide, please. And what we found was that when they had both in place, it both reduced the chances of early marriage and it reduced the chances of early fertility, which particularly the under 15, which is the most high risk. Either one alone was not enough in terms of early marriage or early fertility. So this was, I'm going to briefly, together with Gonzalo, show you a series of studies, even though one could spend the whole time on just one of them, hopefully to spark people in the room's interest in doing some of these studies and partnering and brainstorming more about them. But this one is just an example of how you can study complementarity of policies and how complementarity of policies can matter. Next slide, please. So there are a myriad of reasons to be worried about domestic violence, any kind of intimate partner violence. The numbers are staggering: 641 million women and girls affected globally, more than 1 in 3 women and girls in Africa. Clearly, devastating health impacts for the women and girls directly affected, and ample reason to worry it affects the health of children in the next generation. Gender equality transferred through generational health impacts. On the one hand, one might assume that domestic violence laws matter, but also one might worry that in lots of settings with limited enforcement capacity, limited interest in enforcing domestic violence laws, that just passing a law wouldn't be enough. Next slide, please. So we studied again the children born before and after domestic law passages in countries that passed domestic violence laws, compared them to countries that didn't. You see the countries there. Next slide, please. And there's a really significant impact on reduction of waste, of early wasting across all the countries. The only one where the impact was relatively small, Zambia at 4%, had civil penalties. Everybody else, you can see the countries where the impact was a 29 to 69% reduction in wasting, had criminal penalties, signaling the seriousness. Next slide, please. That having been said, when you disaggregate the impacts, they did have bigger impacts among those with families where the woman had more education in urban areas. So I think it raised concerns about differential implementation and access to the law and knowledge of the law, which we hope to explore in future work, what can be done about it. Next slide. So I'm going to pass the whirlwind back to Gonzalo and look forward to Q&A, and hope this was enough of a teaser so that people know what kind of data we have. Each of these studies took a whole team many months, and really look forward to talking in greater depth with anybody interested. Back to you, Gonzalo.
Thank you, Jody. So I want to close with a couple of thoughts, one for work for the future and another for collaboration. So in terms of work for the future, I think we've almost hit the limit of what we can do with DHS and MICs. There are, however, other sources of data that maybe are not as rich in terms of health information, but they have a lot of information on employment and economic well-being that DHS and MICs don't have. They're usually done under sort of a program that applies more or less evenly to a number of different countries, such as household income and expenditure surveys or the labor force surveys. They have standard variables that makes them somewhat comparable to DHS and MICs. But as I said, they also have this extra layer of economic well-being information that the other two surveys don't have. There has been an effort to make them comparable in the past, notably through a program that the World Bank used to run called I2D2, with, I will say, mixed results. But it's still relatively straightforward to harmonize into a common framework. So this is similar to the map I showed of DHS, except from this you get the idea that you can compare orange with orange, but not with blue, and then red is sometimes comparable with both, but not always. So again, it involves a lot of data work to get this an equal footing for us to be able to use it. So in the past 3 years, we've also been drawing from that source of economic data. And right now we're up to 64 surveys from 18 African countries, spanning more than 25 years, almost 2 million people divided evenly, more or less, between women and men. We cover employment outcomes, which DHS covers in much less detail, including labor force participation, employment status, stuff like what type of job do you have? Is it paid? Is it casual? Is it a contributing family worker? And for some surveys, you also get pretty good salary information, as well as household consumption and expenditure. So everything that you've seen that we've applied to health outcomes, you can also apply to sort of labor outcomes. And if you remember any of the sort of mediation diagrams that we've shown for each policy, there's always a little box that says, actually, if women especially have access to better jobs and more income, that also benefits child outcomes in the long run. So moving on to collaboration, we hope that, as Jody said, this has sparked your interest. All of our policy data is public. If you go to worldpolicycenter.org, you can download it. We just ask that you give us an email address so we're sure you're not a bot when you crash our website. But it's really, really easy to obtain, and we cover a number of different areas. We also welcome deeper conversations about collaborating with other researchers. So the methodology that we have described here is something that can be applied by other people using our data or using different data. And we're more than happy to hear about collaboration ideas. If anyone wants to talk about it, I'll be here all evening. We're also, because we have such good expertise on building comparative policy databases, we do the work that we can with the resources that we have. There are a lot of policy areas that we would love to explore. And I'm sure there are policy areas that other people have thought about that we've never even come up with, that they would like to explore using a similar methodology to ours. So if this is something that interests you, again, get in touch with us, come talk to me, come to ask a question during the Q&A, and we'll be happy to get in touch and to stay in touch. So with that, I am going to conclude. Thank you for your time.
Hello. Okay. Thank you, Gonzalo. Thank you, Jody. Any questions, comments? Oh, Marilyn.
Hi, my name is Marilyn Ahun. I'm an assistant professor at McGill University. Thank you both so much for a really interesting presentation. So I was curious whether you had similar access to data from UNICEF's mixed surveys the multiple indicator cluster surveys, because I particularly focus on early child development, and I know that they recently integrated the ECDI 2030 into the mix. And so we have, for the first time, population level data on child development. You know, the measure has its flaws, but it would be really great to be able to look at some of these questions using that data. And they also have data on parenting practices. So being able to look at mediation models on how different social policies might impact child development through parenting characteristics. And so I'm just curious if that's an avenue that you've explored as well, or if these are some questions that you've explored with the DHS data. Thank you.
So I think the short answer, and I'll let Jody chime in if I'm in any way wrong, is not yet. The latest round of mix is relatively recent. A lot of the studies that we show you when we get to the point of being able to show results, they've been in the oven for like a couple of years now. So I don't think we've had enough time to look at the latest round of mix. I can find out more talking to some of our household survey people, but that's the sort of the short of it is that.
Marilyn, it's a great question, and I'll just add a little more building on what Gonzalo said. First, we'd love to do something together. So by all means, reach out about longer conversation. The challenge with mix right now isn't just that the data is new to us, it's when they started the detailed indicators. So many of their detailed indicators, they started over the last decade. So if you want sufficient both before and after surveys, there are fewer of the policies we can do it on. But it's not necessarily true that we can't do any. It's just a smaller number of total countries that you have to line up the year policy change, the surveys pre-policy change with the indicator, and the surveys post. So you won't see as many countries as we are able to study with these, but we do think it's going to become a more and more fruitful area with time as those surveys go on. So love to explore it more.
I have a last short question from Nick.
Hi, Jody. Very nice to meet you, and thank you very much also, Gonzalez. I know that you, as a group, have written on legislation related to child labor, but I'm not sure, I haven't found that you've worked on actual detail of prevalence of child labor and different types of child labor. You may have done, and I haven't come across it, but I'd be really interested in knowing about that and the influence of other policy areas in relation to differences.
Thank you, Nick. Gonzalo, is it okay if I dive in first and hand it back to you?
Yeah, please do.
So first, I also want to take the chance just to thank you, Nick, and thank Louise, as well as Lisa, Lana, and Samuel, and everybody who's helped you over the years. And it's been extraordinary what you built with this network, and everybody who's committed their time to coming. We're really thrilled about it. So there are two sources of child labor data. One, the existing data in DHS and mix, which is relatively limited, and the other is ILO. It's not non-existent, but it's a little limited. We've tried at different times to see if we could get access to more detailed child labor data through ILO without success. What we'd like most to know is not only do children labor, but the nature of the labor, how much is hazardous work, are they doing enough hours to impede school, what are the conditions of work, which is why we've sought the more detailed, which we haven't been able to get. We have not yet done impact studies between the child labor areas and these outcomes, which the existing data exists for largely older children. And this particular foundation grant was focused on 0 to 5-year-olds, but that too would be an area we'd welcome. And I think it'd be invaluable to look at multiple policies, not only the child labor policies, but parents' minimum wage and how it impacts it and some of the others. Gonzalo, anything to add?
Yeah. I'd just like to add, we've had a child labor database in the past. We haven't updated for a while now, to the point that the data is probably not as reliable as it should be for us to do anything with it. But I think part of it is, as Jody mentioned, the lack of opportunity to do something useful with that data because we can't marry it to the appropriate outcomes data. We always talk about reviving the database, and if there's any way for us to get better outcomes data, we'd love to bring the database back. And that database does cover different types of labor at different ages, how it interferes with school. It has actually a lot of detail. We just need a good way of linking it to outcomes.